Good afternoon, everyone. It's 2 o'clock and time to start today's briefing. Joining us on the panel today, we have Milwaukee County Executive David Crowley, Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services at the Milwaukee County Office of Emergency Management, Marlena Jackson, Interim Commissioner of the Milwaukee Health Department, Dr. Brad Smith, Psychiatrist and Medical Director for Rogers Behavioral Health's Oconomowoc campus, and Dr. Chad Wetterneck, Licensed Clinical Psychologist who serves as the Clinical Director of Trauma Recovery Services at Rogers Behavioral Health. County Executive Crowley, you're up first.
Thank you so much, Sydney, and good afternoon to everyone, and happy Black History Month. Today is the first Black History Month, and as many of you know, each February, we celebrate the proud history of Black Americans who have made significant impacts, not only across Milwaukee County and our state, but across this nation. So this Black History Month, and honestly every month, Milwaukee County is working toward our vision of achieving racial equity to become the healthiest county in Wisconsin. And we have many examples of that, and we've exhibited that by tracking the data by race on the Milwaukee County COVID-19 dashboard. And so we were among one of the first to include this type of demographic data. And while Milwaukee County does not have a health department, we are committed to supporting our local health departments and health systems to ensure equitable and accessible vaccine distribution. Internally, across all Milwaukee County departments, we have stepped up our racial equity efforts. And we are increasing our visibility in the community in responding to racial injustice as well as the community needs. And so in the weeks ahead, we will be highlighting several history makers that span all across 19 municipalities, and stay tuned for more of those details. But I want folks to remember that together we can and we will create a stronger and more equitable Milwaukee County. And as we're speaking about equity, we know that COVID-19 has disproportionately impacted our communities of color. And we know that testing numbers are down. And that's why I want to emphasize that testing is still a critical piece in the fight against COVID-19. And we all need to do our part to stop the spread of this virus. So if you're feeling sick, please get tested. It's free. It can save your life and those in your community. But while vaccines are still being rolled out, that does not mean we can let up on our COVID-19 precautions. Vaccines are just one of the tools that we have in our toolbox to stop the spread of COVID. And as I always say, we have to remember that we are practicing the 3 W's, which is wear a mask, wash your hands, and watch your distance. And before I pass it over, I want to extend a warm welcome to our guests, Dr. Smith and Dr. Wetterneck from Rogers Behavioral Health. And soon they will be talking about the impact of COVID-19, particularly with individuals with existing mental health concerns. We know that this pandemic has taken a toll on the mental health of Milwaukee County residents, but there are medical professionals and organizations around in the area who are helping to address these types of needs. And so I want to encourage you to reach out and seek help if you or a loved one is currently struggling. We need to make sure that we're giving people access to all the help that they need. And I want to say thank you again, happy Black History Month, and hand it over to the mayor and thank him for his partnership as well.
Well, thank you very much, Mr. County Executive, and good afternoon, everyone. As we celebrate Black History Month, I want to reaffirm the city's commitment to ensuring equity and opportunity for all of our residents. I continue to be concerned about the racial disparity in COVID-19 vaccination. One of the things that I saw in the first week of reporting was that we saw pockets where the disease was affecting people, and we saw areas where people were getting the vaccinations, and unfortunately they didn't match up. The areas where we saw initially the highest concentration of COVID-19 was not the area where we saw the testing first. And so I've been keeping an eye on the state's vaccination data weekly, as well as our local vaccination data. And I've been very vocal and very clear that I have not seen the diversity necessary to reflect the population that we have here in Milwaukee. And that should be a concern to everyone. So I want everybody to get the vaccination. I want everybody to get the vaccination. And I am concerned that some people don't want to get it, but that's a topic for another day. I want people who want to get the vaccination to get it. But I also want to make sure that we're doing this in an equitable fashion. And so for that reason, because of the numbers that we saw, what we did is that on the first day of vaccinations for Milwaukee residents 65 and older at the Wisconsin Center, we conducted outreach to increase the racial diversity of people getting vaccinated. We made direct connections with one of the city's public housing neighborhoods for signups, and we actually secured a bus to provide transportation. I've seen this as a national issue, as a regional issue, and as a local issue. And I think we all have an obligation to make sure that all of our residents are treated fairly. And that means that we have access for all of our residents to get the vaccination. So we're also working with churches and other institutions to make sure that we are reaching everyone fairly. This is a real concern of mine, and it's something I'm going to continue to work on. I want to talk about testing, and we are seeing the testing numbers go down. And I know Dr. Weston is going to talk about this because we're seeing the positivity rate go down as well, which is a good thing. We like to see the positivity rate come down, but we don't believe it's now to the point where we can accept lower testing. But at American Family Field, Miller Park, there were 526 people who went through yesterday. Let me give you a commercial. If you're interested in going there, a friend of mine went yesterday to get tested. I said, I want you to time it. How long between the time you stopped there and the time you left? And he texted back to me and he said 4 minutes. So it took him only 4 minutes to get through the entire process at the ballpark. So again, if you're feeling symptoms or if you've been in contact with someone, 4 minutes of your time is not a big investment. We also saw 194 people tested on the northwest side and 129 people tested on the south side. So these numbers are concerning because we are not yet at the point where our testing numbers are in line with the prevalence of the disease in our community. And again, Dr. Weston will talk a little bit more about this when he speaks. We're also going to hear from our commissioner, Commissioner Jackson, because we will have a new health order coming out later this week. We're optimistic about where we stand regarding our current percent positivity for COVID-19, but we are proceeding with caution with our new health orders. It's not yet clear, and this is, I think, something we all recognize if we're watching the national news. It's not yet clear how the new strains of COVID-19 will impact our community. So the Milwaukee Health Department was very strategic and thoughtful in its approach moving forward. And again, Commissioner Jackson and her team have put a lot of work into this. It will have an impact on churches, it will have an impact on sporting events. And so stay tuned for Commissioner Jackson as she'll talk a little bit more later in this briefing about the new order. And with that, I'll turn it over to Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First to our numbers, we've had 94,930 confirmed cases of COVID-19 in our community and 1,012 individuals who've died in Milwaukee County. That number, 1,012, comes from our medical examiner in Milwaukee County, and it's a grim milestone in our fight against this pandemic. It's over 1,000 fathers, mothers, husbands, wives, neighbors, and friends that will not be able to rejoin us as we begin to return to life as normal, hopefully in the near future. We've slowed the rate of death in our community, but they are still occurring. It's about 4 people on average per day who die in Milwaukee County from COVID-19. But with the right steps individually and as a community, we can drive that down even further. On a positive note, we continue to see promising decreases in cases and hospitalizations, as well as in our percent positivity. As mentioned, testing does remain low, and it's as important as ever to get tested if you have symptoms, close contact, or are referred for testing. A question that's begun to arise regarding testing is how much is enough for our community, especially as our positivity numbers are declining, indicating a lower burden of disease in the community. So certainly as our rates hopefully continue to improve, there will be a time when we can start to pull back on our testing goal numbers. However, we're certainly not there yet. Once we get to a percent positivity below 5% on a consistent basis over time, we can start to feel more comfortable reevaluating those testing goals. But until then, we really want to shoot for about 4,000 or more tests per day on average in Milwaukee County, a number that we're not quite achieving at this point with our 7% positivity. Additionally, we must be very cognizant of the landscape that surrounds us both at the state and the national level, as well as now increasingly with the new strains at an international level as well. These new strains present a tighter and more urgent timeline for vaccine administration. It is foreseeable that if we allow these new strains, particularly the ones from South Africa and Brazil, to take hold among a large portion of our population, we could see a significant spike in disease, potentially far greater than we've seen yet due to the variant's increased transmissibility, as well as its ability to evade previous immunity. So this puts us up against the timeline. Can we vaccinate enough people to even begin to blunt the spread of disease before these strains take hold? Now, unfortunately, national shortages of vaccines have made these efforts more challenging, particularly this week when many of our vaccination sites have had to pause their workflow due to short supply of vaccine. Now, that said, there do seem to be concentrated, well-resourced, high-level efforts now nationally to rapidly and safely ramp up vaccine production. And this, in addition to the hopeful approval of other vaccines in the near future, should greatly enhance our ability to distribute vaccine quickly among our population, especially those most in need. But for now, as hard as it is, please stay patient. I know it's incredibly frustrating to have vaccine out there and to be in an approved population, but not be able to get it. Vaccine is coming at a national level, and that'll come down to a local level, but we will continue to update you here on local vaccine availability as well. Thank you very much. Stay safe, and I will hand it to Commissioner Jackson.
Thank you, Dr. Weston. So first, happy Black History Month as well to everyone who is listening, and want to first talk about our new orders. So Order 4.4 of the Moving Milwaukee Forward Safely order set is out today, and it goes into effect this coming Friday, which is February 5th at 12:01. And I'll just go over some of the high-level changes in the order. So first of all, and probably the biggest change is the gathering limit changed. So our new gathering limits are set at 25% capacity of the venue, or up to 250 individuals. So that number of 250 is up from 25 in our past order. For establishments that are seeking anything above the 250, we have been able to work within our internal systems to ask that you submit a safety plan to the City of Milwaukee Health Department. And there are links actually on the Moving Milwaukee Forward Safely webpage, as well as in the actual order, for templates for any individual venues or organizations that would like to have individuals over the 250. Additionally, there are no longer testing requirements for team sports or other recreational activities in the city. Sporting events are allowed to have 2 observers for each participant, or again, an approved safety plan. We feel very comfortable that we are able and have the capacity right now to receive safety plans and get those reviewed in a timely manner. Please know that while these changes are loosening up, if you will, are per our past order, as we've shared before, this is information that we use. We look at our gating criteria every week to make sure that our trends are going in the right direction, and knowing that we are making these decisions very cautiously, very aware, and very purposeful, that at any time throughout our process, our gating criteria, which right now are generally positive, could change. And understanding that that change could happen, we know that we have to continue to remain flexible and make sure that we're getting information to you all in a timely fashion. So with that, know that the decisions regarding orders moving forward, we're going to make those decisions on 2 incubation cycles, or about every 4 weeks now, versus in the past we have looked at making those decisions every 2 weeks. And again, that's just in an effort to make sure that we're following the science and we're being very mindful about the trend lines in which way they are going. Also want to be clear that we will continue to use our science to make these, to move forward in making our decisions. And so we will stay optimistic, but we will, again, also be cautious as we move forward. So now I'm going to move on to vaccines. So first, we just want to share that the Milwaukee Health Department has been providing vaccinations for 17 days. Today literally marks 17 days that we have been providing vaccinations to the City of Milwaukee residents, as well as Group 1A unaffiliated health workers. And so we're excited to do the work that we're doing. There is definitely a good sense of moving forward through this pandemic as we do our best to vaccinate individuals that are appropriate for the groupings. So this week, the health department received both Pfizer and Moderna vaccines. Our Pfizer vaccines were second dose vaccines, or individuals that had received Pfizer 3 or 4 weeks ago and are now due for their second shot. And our Moderna vaccines would be our new individuals that will be vaccinated. So this week we plan between the first and second dose to vaccinate almost 400 individuals, but know that there is still more demand for vaccine than there are actual doses. And that means that the Milwaukee Health Department will continue to do our best to make sure that our schedules are appropriate to meet the needs of all of the approved groups that have been named. So this week also, we started to vaccinate our 65 plus or 65 older individuals. We started that yesterday, and I know that we were able to vaccinate about 600 or so individuals yesterday. And so I just want to say, first of all, thank you so much for being patient with us as we were finishing up our thousands of 1A unaffiliated healthcare group in the past week. So thank you for that, and know that we hear and understand the questions and the urgency as it relates to our 65 plus population, including making sure that we're being equitable in the work that we're doing. So the biggest question that we have received lately is, how do I get registered? How do I go, and where do I go, and when can I go? So I am going to do my best to just pull up a screen here. I think you guys can see my my COVID vaccine. Great. So what you're seeing in front of you are our two ways that moving forward as of tomorrow. So tomorrow at 2 p.m., individuals will be able to go to the Moving Milwaukee Forward, the Milwaukee Gov COVID Vax website and register to schedule an appointment. I'll talk a little bit in a second about what that means, but know that is one opportunity or one way for individuals who fall into the appropriate category to get registered for a vaccination at the Milwaukee Health Department. In addition, for individuals who do not have internet access, you can call our hotline, which is noted there, 414-286-6800. So know that, again, those are the two options that individuals have 65 plus to get registered under our current scheduling system, which again goes live tomorrow at 2 p.m. Once you go to the Milwaukee website, what you will see is what you're seeing on your screen right now is a screenshot of what that will look like once you go to the COVID Vax website. And the first thing that you're going to see is a general scheduling kind of notification. It talks about who is the appropriate group that right now is getting vaccinated at the city of Milwaukee, meaning is it 65 plus? Is it healthcare workers? Is it fire and police? So just some basic information. And then it's going to ask you or prompt you at the bottom there to make an appointment. Once you click that button, you'll go to a new screen, which is the actual vaccination scheduling screen, which you see right here. It gives you some general information, and then you would click here and go to make an appointment. And from here, I'm gonna stop sharing. Okay. So from there, you will be prompted through a series of screening questions. Those screening questions are purposeful and meant to make sure that individuals who are not appropriate for scheduling at this time for a COVID vaccine are screened out. So it's very important that individuals who go to this website and who go through the process are truthful and honorable as they are taking appointments that are meant for particular groups of people. So to make sure that we are vaccinating the right individuals here in the city of Milwaukee, because we understand that there is just an inherent risk in putting this link out on the health department website, we're going to do 2 checks. So first of all, every day we're going to go through our list and we're going to make sure that individuals that are not appropriate are canceled out of that appointment schedule and slot, and that individuals who are appropriate are put in. Additionally, once you get to the Wisconsin Center for your scheduling, we will then be requiring that you show an ID to prove, again, where you are or who you are based off of your screening questions and how they were answered. So the last thing I want, and again, just to share, that will be up live tomorrow at 2 o'clock. So then lastly, I want to talk about just our overall equity efforts as it relates to the city of Milwaukee. And we know that the pandemic has exposed systemic and racism inequities in care, and that the vaccination process has really brought back to the forefront the overall mistrust and fear that Black and Latino and other minorities have felt in years as it relates to medical treatment and medical care. And we also know and want you to understand that we, as health providers and at the City of Milwaukee Health Department, understand those challenges. We understand the barriers. We understand the fears, and honestly, the questions that are also rightfully felt and rightfully asked. We also, on the other side, though, understand that there is real and true commitment to the mission of erasing equity, of looking at systemic racism as it affects care, and understanding that there are real efforts being made to address the issues as we see. So know that as part of our tactic for vaccination and addressing equity, the Milwaukee Health Department will use our Wisconsin Center as our larger center for individuals as they move through approved phases. And we will make sure to address equity issues, that our tactics are to go into the community in whatever capacity that means, whether it means going into particular work sites, whether it means going into churches and other areas, barbershops, whatever it might be, to make sure that we are going directly to the people that we are purposefully trying to impact by equity to reach our equity goals. So we are really excited about that work. We're excited about our mobile teams. We are very excited about the number of individual establishments and spaces that have reached out to say, I have a space, you can come, you can vaccinate here. So just know that as we continue to move through our phases, we'll start to roll out our mobile unit plans and we'll share them here. So there is more to come on that. And that is all I have. I will turn it over to Dr. Smith.
Thank you very much, and it's a pleasure to be here this afternoon. And thank you for allowing me to talk about this topic, which is about the effect COVID-19 and the pandemic is having on the mental health issues for individuals in our community, and certainly across our nation and world for that matter. And when I think about the impact of COVID-19 on mental health issues, I think of this in a couple of different categories. One, maybe individuals who were not necessarily suffering from mental health issues or mental illness before the pandemic. And even for those who felt pretty well adjusted or not suffering from mental health issues prior to the pandemic, I think there's been a significant testing of the resilience of any of those individuals during this time. And then if you take someone who already had mental illness or significant mental health concerns or addictions, these things were certainly intensified or had the potential to be intensified during this time. And that's exactly what we're seeing in the clinics and in the hospitals. And we think about how this affects the mental health of individuals. We can think of it in many different ways. Each of us may have had to deal with the illness of COVID itself. We may have had family members or friends who have had it, so we have that baseline fear of the health and integrity, or even the life of individuals that we know personally and that are important to us. We may have not been affected so directly in that manner, but maybe we're affected more by all of the changes in our environment and our world that we have to do to try to keep ourselves and our communities safe. So the closings of schools, the limitations on us getting together with friends, family, our usual support systems. And another important factor, there's been limitation on the mental health services available for individuals during this time of crisis because of the infection risk in clinics and in hospitals. So we have seen a number of ways in which COVID-19 is directly impacting people's mental health. So we look at the normal ways that people might be protected from mental health challenges or mental illness, and many of these are affected by even the basic things that we have to do for infection control policies around our communities and in our environments. So we see a number of ways that COVID-19 is affecting mental health issues for individuals. Many times mental illness actually is precipitated by a major stressor in our environment or in our life. And that can be some of the stressors that COVID-19 is bringing to us. So we see the onset of major depressive disorders in individuals. We're seeing the onset of anxiety disorders in individuals who may have otherwise not had those illnesses before, but this is the stressor that is bringing it out. And certainly for individuals who are already dealing with those issues, intensifying it. I think some of the biggest concerns comes in the way that we're seeing increases in suicides and increases in overdoses in our communities across the nation. Earlier this summer, the CDC issued a notice that compared to the year 2018, there was about a 150% increase in adults surveyed who had seriously considered taking their lives in that month compared to the same month in 2018. So significant changes, and that really is what's happening in our anecdotal experience in our clinics and our hospitals, with more individuals coming in with acute mental health crises and having a higher severity of symptoms and challenges that they're facing compared to our practice even a year or two ago. I've often asked, what are the warning signs that families should look for if they're worried about an individual in the family? And I think the broadest category is to consider, changes. If you see changes in your friend or family member, your loved one, major changes in how they're interacting with you or how they're interacting with the world, those are some of the things that lead us to concern about the person. When we get concerned about the mental health challenges leading to more of a mental illness or more severe situation, we also look at how that's really affecting their ability to function, such as their ability to go to work, to show up for school, their ability to handle basic routines in their lives. And as we see things start to deteriorate, the other warning signs you might look for would be changes in their physical health. It could be changes in their sleep cycle, changes in their ability to concentrate, changes in their ability to function in terms of eating, drinking, the basic demands of life. And then, of course, major warning signs if there's any talk about suicide or more of a prominent preoccupation with death or hopelessness. These are major warning signs for families to be aware of. And then, of course, the next question is, what can family or friends do for individuals that are stirring that concern? Well, on the most basic human level is to be that support for the individual. To know that the support of family and friends is one of the major factors for individuals to stay mentally healthy. And it's one of the major factors to help people in recovery processes. So be that support person, share the compassion, be open-minded and supportive of what they're dealing with, and to provide a safe space for them to talk about the challenges that they're facing. And if some of these more serious warning signs are there, to also offer to assist the person to get more professional help. That can be through, outpatient clinics. It can be through helplines. And when it's more serious, where there's any discussion of suicide, any discussion of serious problems with safety, then the individual should be assessed in a local emergency room, including perhaps even needing to call 911 if a person is in the midst of taking action on their life. So we have a full spectrum of ways that people can intervene knowing that an individual may need a very high level of intervention, such as a trip to the emergency room to get assessed, where mental health services can be assessed and the person can be sent then to the appropriate clinic, hospital, or treatment center for the individual to receive treatment. So certainly the COVID-19 has impacted our lives immensely, and for mental health issues in particular, we're seeing a significant increase across the country, and especially in our communities, because where we practice and where we live, we're more accustomed to knowing what the norms are in terms of how significant or how severe the mental health crises are. And there's certainly been an uptick in the local communities here. And with that, I will turn it over to Dr. Wetterneck.
Thank you, Dr. Smith. I want to wish everyone a healthy and happy Black History Month. And I want to talk a little bit about some advice that we can all use during these challenging times. And I'm going to talk about the need for awareness, acceptance, and adaptation. So when people ask me, how do we deal with what's going on right now in the world, COVID plus everything else? So the first step we need to do is be aware of what our challenges are. And for many of you, you know what those challenges are for you, but I want to walk us through what those are for many of us, which include the fact that we are facing a realistic threat of life being compromised, and that's going to raise our stress systems and be more taxing on us as individuals as we go through our regular days, whatever those look like now. It's going to lead to greater loss in our community, and that loss is going to be felt in many different ways. It could be the loss of what you're able to do. It could be the loss of lives of people you know and love. It could be the loss of jobs or other things that have an economic impact on you, or the need to stay at home and work with children going to school. So many changes. In addition to that, and some of these have already been lifestyle changes that we have to make, most of us are not able to do and lead our lives the way that we were used to. Last but not least is the conflict that's going on. So there is a lot of debate about the whole COVID. How dangerous is it? Do we need to get a vaccine? I'm not here to tell you that there should be a debate, but more so that we need to be able to acknowledge that this debate itself is also stressful. All of these things are things that we need to be aware of, because they are going to increase our ability to actually fend off all of the regular life tasks that we have to do on a daily basis. So I want people to be aware of that and to be able to acknowledge you are under more stress right now. And with more stress comes the need for more coping skills, which brings us over to two options on how we can try to deal with what's going on right now. And that's summarized by acceptance and adaptation. Now, by acceptance, I don't mean to say that you're just supposed to throw your hands in the air and say, I just have to accept that all of these bad things are happening. But we have to be able to sort our challenges into two main groups: the things that we can change and the things that we can't change. For the things that we are not able to change at this point, we have to find some way to move closer to what I call acceptance. And what that could look like for you is to acknowledge what you can control and what you can't control. If it's not something that you have direct control over, it's fair to acknowledge that that's a challenge for you, but that also that maybe your time is better spent in the areas in which you can have more change in your life and change in the life of others around you. It's also to acknowledge the things that you've been doing every day that are still going right, and to accept that part of your life is still going right. And for some of you, that can be more challenging than others. And you have to look at the point of you're still alive. You may still have people close to you. If you still have a job or other things that you engage with on a daily basis, those are things to acknowledge and be grateful for. It will also require a lot of adaptation though as well. And we are trying our best, and we're trying to use short-term strategies sometimes to make it through on a minute-to-minute, day-to-day basis. But we need to take a little bit of time, maybe even 10 or 15 minutes, and take an inventory of what works for us and what doesn't work for us. So for those of you that are struggling, I'd encourage you to spend a couple of minutes of writing down a list of activities that you've ever used before in your lifetime. to relieve yourself of stress, to decompress, to get a break, or to find the connections that make you feel alive and content. And look through that list and see what have you done lately versus what haven't you done for months or maybe even years now, and consider engaging some of those activities. Another way to look at this would be to write down a list of some of your favorite people, whether you've been in touch with them or not. Write down your top 10 or top 20 people. Consider reaching out to them. This doesn't have to be in person. Obviously, we're trying to emphasize social distancing. It could be reaching out via text, an email, scheduling a Zoom, Skype, Microsoft Teams, or other meeting with them. Part of the adaptation too, after you acknowledge what's going wrong, after you accept the areas you can't change, and then you're looking for other change strategies, is try to utilize asking for help. Look for people around you that may be in a situation where you can connect with them. And also, if you are the person that might be better suited to help others, try to build up your community. And that means not just the people in your house, maybe some of your neighbors, maybe people that are down the road, maybe people at work. Offer help to each other. And then I hope that you're all willing to accept it.
Thank you, Dr. Smith and Dr. Wetterneck. We'll now open up for questions from the media. We have a number, so bear with me as we work our way through the list of questions. The first question is from Derek Rose at WISN 12 for County Executive Crowley. The Dane County Executive announced their county applied to host one of the 100 federal COVID vaccine sites. Has Milwaukee applied to do the same? If so, when do you expect to find out? If not, why not?
I think that's an excellent question, but what we are hoping here in Milwaukee County is to leverage all of our assets to make sure that we can bring the vaccines to all of our residents as quickly as possible, which may include a large vaccination site. But a lot of this depends on many of the changing developments as well as the timeline with the federal government.
Our next question comes from Patrick Palantonio at WISN 12. According to reports, the Bucks expect to allow some fans at the Fiserv Forum by the end of February. How many people would be allowed inside the arena, and what is the city requiring of the team to get fans back in the stands?
So the Bucks and Milwaukee Health Department have been meeting regularly to talk about their current plan. They have submitted a plan to the Milwaukee Health Department. And so we are working with them to do our best to make sure we have some fans at some point moving forward.
Our next question is from Drake Bentley at the Milwaukee Journal-Sentinel. Does the city have racial and age breakdown data on the people vaccinated yesterday? And has the city of Milwaukee or Milwaukee County applied to be one of the 100 federal COVID-19 vaccination sites? I think we just answered that one. And then can people who do not live in Milwaukee County come to the Wisconsin Center to get the vaccine, or is it only for Milwaukee residents?
So for the individuals that were vaccinated yesterday, we don't have data on that right now today. What happens is as we register individuals, that information is put into our state system and then gets generated back to us. So we'll have that information in the future, but we don't have it literally the next day. Additionally, to the question regarding the city of Milwaukee or the Wisconsin Center. So if you are over 65, we are requesting that you do live in the city of Milwaukee. So we are vaccinating at the Wisconsin Center residents that are 65 plus that live in the city of Milwaukee.
The next question is from Ben Wagner at WISN, a follow-up on the Bucks reports. Just to clarify, have the Bucks filed a safety plan to allow more than 250 people inside?
So again, they have submitted a safety plan, and that number has gone back and forth a little bit. So we do know, so the plan has been submitted, and again, we're going to work with them to make sure that the numbers that they eventually have will be a safe number.
We actually have several questions about the Bucks. I believe we've covered off on all of them. If there isn't, if we haven't, please go ahead and re-type in your question into the chat. Next question is from Patrick Palantonio at WISN 12. To clarify, did you say nearly 400 people are expected to be vaccinated this week at the Wisconsin Center? Also, can you repeat the difference in capacity numbers between the current order and the new order?
So we anticipate close to 4,000, not 400. And as it relates to our total numbers, so this, again, this current week, we received around 4,000 doses, understanding though that those are both second doses and first doses. So when we kind of talk about numbers that are ordered, so for example, if we're ordering 5,000 vaccinations, that could be a combination of, let's say, 2,000 that are second dose and 3,000 that are first dose. I would just add that, you know, the reality of our supply and demand is shared, and the availability of vaccine makes all the difference in all of these numbers. So we can plan the best we can, knowing that we get our allotment numbers at the end of every week usually. And so we have to move quickly throughout the next week to make sure that our schedules are aligned with what the actual vaccine allotment is.
The next question is from Drake Bentley at the Milwaukee Journal-Sentinel. Milwaukee Health Department reached out to churches yesterday. Have any communities showed hesitance to the vaccine?
Sure. As I stated earlier, we know that Black and Latino communities, particularly, as well as others, have very known hesitancy as it relates to general medical care and absolutely vaccinations. Just from historical trauma, I mean, we could roll down the list of Tuskegee and other type of events that have really traumatized particular communities. So yes, there is absolute hesitancy. And again, we know that, we're aware of that. And so our role at the health department is to figure out, how do we get past that? How do we work past the mistrust, and how do we work past the fear?
Next question is from Tom Durian at TMJ4. A follow-up on the sports questions. Would this new order apply to the Brewers, and has the team submitted a plan for fans to attend at American Family Field?
So the new order would apply to the Brewers as well, any sports in the city of Milwaukee. And we continue to work with the Brewers, just like the Bucks, moving forward. So we are in constant communication as they work through their plans.
Moving on to high school sports. Patrick Palantonio from WISN 12 has the question related to sports. Do high school teams have to file plans to allow fans, or will they automatically be allowed to have 2 fans per participant effective this Friday?
If your high school is going to have the 2 fans per participant, then there's no need to submit a plan. It's only if you want above that you would need to submit a safety plan to the health department.
Another question from Patrick for Commissioner Jackson. They've received questions about the Healthy MKE website. Will the Healthy MKE website include a link to the new vaccine sign up?
Thank you. That's a great question. So right now, the Healthy MKE website does not have a link. We can work to see if that's something that is possible. But what we are asking is that individuals go directly to the Milwaukee.gov COVID Vax site. That's going to be your cleanest and clearest way to get to the vaccine schedules. Again, understanding that those schedules are based on our actual vaccines that we have. And so if that schedule is full, we're asking that you just keep checking back.
From Tom Durian at TMJ4, is the Bucks plan approved? They made announcements today. They expect fans to attend on February 16th.
So the original plan that was sent to the Bucks, that was sent to the Milwaukee Health Department, is in pending. So we are very close to approval, just working out the last bit of details.
Next question is from Emily Files at WUWM. Who should use the Milwaukee.gov COVID Vax website to sign up for a vaccine? Any City of Milwaukee resident 65 and older, or only those without a primary care provider?
So we would like to prioritize individuals that are underserved or underinsured or uninsured first for 65 plus City of Milwaukee residents. However, at the end of this entire endeavor, our goal is to get shots into individuals' arms that live in the City of Milwaukee. So if you are 65 plus, you can go to our website and you can get scheduled.
Our next question is from Ashley Sears at Fox 6 News. For anyone, Summerfest organizers announced the festival is moving to September to allow more people to be vaccinated. Does this seem like a realistic time to allow a very large gathering?
So I can start off by just saying that Summerfest has not yet submitted a safety plan to the city of Milwaukee, but we are so hopeful that as of September we should have good vaccination numbers, and that our case numbers based off of the vaccinations are down. So I guess I would just personally say we hope, and we will try to remain optimistic.
I would just add to that, I think a lot of it depends on supply and people's willingness to take the vaccine. If we had endless supply of vaccine, I think the city, the county, the municipalities would be able to vaccinate people quickly in efficiency and hopefully meet that optimistic timeline. So we're very hopeful that on a national level, more vaccine will become available.
Next couple questions are from Nick Bohr at WISN 12. You mentioned the sign up portal is for those 65 and older. Can those in group 1A sign up as well? And will the portal basically be first signed up, first served, or will there be some other screening or prioritization?
So once you go into the actual portal, there are screening questions that are asked before you get to the point of making your appointment. So it's asking information or asking questions around your age and what type of work you do. Are you a healthcare worker? So to answer the question around 1A groups, they also can go to that website to get registered. It is first come, first serve, understanding that we have made sure that the schedules are appropriately separated so that we have ensured that we have room for 65 plus. We've ensured that we have room for individuals who are actually calling and scheduling through our hotline number, and that we have room for 1As as well.
Next question is from Sean Gallagher at TMJ4. Do you anticipate more hyper-localized vaccination sites? Oops, hold on, just lost the question. Do you anticipate more hyper-localized vaccination sites to help with the racial disparities we're seeing in vaccination rates?
It's our hope. I'll take that. It's our hope that we will have more sites, and I'm confident we will. We had a conversation yesterday with some church leaders. We're dealing, as we've done earlier this week, with some public housing officials. So we want to make sure that we're bringing the vaccination to the people as well. A lot of this, though, is going to be dependent, of course, on the supply. So the faster we get the supply, the more we can have it injected into people's arms throughout the entire community.
Next question is from Derek Rose at WISN 12. Is the Wisconsin Center turning away people who are not Milwaukee residents?
So what we're doing is when we are able to go through our schedules again and identify individuals that are registered, and if they are registered inappropriately, we are canceling appointments, which means we're reaching out to those individuals by phone to cancel those appointments.
Marlena, maybe you can help. This is not a walk-up facility. In other words, people are not coming in off the street, they have appointments. So it's not that we're turning away people who aren't Milwaukee residents, we're turning away people who don't have appointments. That's the key, that this is for appointments only right now.
It looks like we're coming in on one of the last questions. So media, if there are any additional questions, please be sure to put them in the chat. The next question is from Emily Files at WUWM. When does the Milwaukee Health Department plan to vaccinate teachers?
So right now, teachers fall into 1B category, and I believe the governor has stated that education and daycare group will be eligible for vaccinations March 1st. But know that we are continuously working and communicating with our education and daycare group to plan so that as soon as we can, we will.
I believe that's all the questions. Last call for questions from the media. All right, everyone, thank you so much for joining us today. We'll be back here again on Thursday.
Thank you, everybody.
Thanks, everyone.